Okay, we are live. I'm just going to share the live stream link on our Twitter and our Telegram, and then we can kick off. Okay, there we go. Welcome everyone to today's live video AMA. It's the 6th edition of our monthly video AMA series. As probably you are aware, my name is Raymond van der Waal. I'm head of marketing at Triall. And similar to last times, I'm joined here today by our CEO, Adil Esbay, our CTO, Niels Klomp, and our Chief Medical Officer, Dr. Arno Bisschop.
Thanks so much, Ray. We're really looking forward to a great AMA today.
Yes, and a great day in general, I guess.
For sure. Yeah, it's a special day today. We publicly announced our partnership with the Mayo Clinic. And for that reason, I'd like to start off with any questions related to that partnership and the implications for Triall. So the first half of this AMA, we will specifically focus on the Mayo Clinic collaboration. And then the second half, we can answer some more generic questions about recent developments, about our technology, and also some live questions from the live audience. So without further ado, I'm going to start with the first question, which goes as follows. Congrats on the Mayo Clinic partnership. Could you explain the significance of this collaboration? What will be the impact on Triall and the adoption of blockchain? Adil, would you like to take this first one?
Yeah, sure. So I think we've gotten a lot of questions about the announcements that we made today. Well, we basically see it as a external validation for what we're doing and for what we've been working for so hard in the past 4.5 years. For us, it's a culmination of, us trying to be a thought leader in our space, but also being ready to collaborate with an esteemed party like the Mayo Clinic. So for us, it's a major milestone. And so the Mayo Clinic is a highly renowned medical center, very well known globally for its scientific and medical excellence. And yeah, we think that other customers, other partners, their interest will be even more triggered once they found about this collaboration. We now have this first study that we will be collaborating with the Mayo Clinic on, but we've also discussed co-innovating together with them. And in due time, we'll definitely let everybody know about what we're up to and also publish the results in scientific, but also general media. But I really feel this is just a start of a very, very exciting journey. So thanks for the question.
Thank you, Adil. That brings me to another question related to Mayo Clinic. I read Triall will support a pulmonary arterial hypertension trial that includes 10 research sites and 500 patients across the United States. What does this trial entail, and will we see more clinical trials coming from Mayo Clinic? Arno, perhaps you want to answer this one?
Yes, thanks, Ray. Well, first of all, like Adil, I would like to congratulate everyone working on this project, on this major milestone. I think it's a great day for Triall. Coming back to the question, I mean, so we are doing this cardiology trial involving 10 sites across the US, and basically it means that patients will be recruited in 10 different sites across the US. So meaning that a lot of physicians will work on this trial. And in my belief, when a physician is very happy using a certain tool, and it could be a software tool, it could be a medical device or whatever, they will never leave. So it's our job to make them like really, really believers on the trial kit that we offer. So I think that if we do that, and we will do that, a lot of clinicians will use trial kit as their main platform, because most physicians, they don't like working in all sorts of environments, software environments, or certain medtech devices. They just use the best thing there is in the market. So that's our job, that we will be the best in what we do. And the other thing is that if a clinician performs a study, he or she will go into another study within a year, 2 years, maybe even parallel to each other. And again, if he or she is happy working with the system, then he or she will use the system again in different trials. So I think there's a lot of upselling potential here. And with a partner like the Mayo Clinic, I mean, we're doing very well. And this was a very, very big milestone today.
Thank you, Arno. So the third question I have relates to the TRL token. And the question is, will the Mayo Clinic partnership have an impact on the TRL token? Well, the answer is yes. And with each new study that the Mayo Clinic conducts on the trial platform, TRL tokens will be purchased according to our token economics model, which we actually updated last month. We will share some more details on how that will impact in relation to that first clinical study, so the cardiology study that Arno was just talking about. That study will actually start this month, so the token economics will also kick in this month. And of course, as we onboard more studies from Mayo Clinic, and there is a lot of upselling potential there. I think Mayo Clinic conducts more than 1,000 studies on an annual basis. They have more than 4,700 physicians working for Mayo Clinic. So we do aim to onboard more Mayo Clinic studies going forward. And each time we do that, we will make sure to also initiate the token economics in accordance with how we presented that last month. That brings me to my fourth question. How did you get involved with the Mayo Clinic, and are there more big clients upcoming? Hadil, would you like to answer this one?
Yeah, sure. I think we were approached by the Mayo Clinic over a year ago, and we've been building a very good and fruitful and informative relationship with some of the leaders at Mayo Clinic, and they have been very, very supportive to our mission and vision. We've also, as a small group, recognized a lot in the mission and vision of Mayo themselves. They really believe in digitalization of clinical workflows, clinical trials in general, in the fact that hybrid or virtual clinical trials, are a good means to make sure that we can not only generate data when it's happening, it's often more and more at the patient's home, but also in the need to have an infrastructure where you can easily, reliably, and also cost-effectively manage your clinical trial. As to other big clients, we're bound to strict NDAs, and that means that we can only go public with these announcements after thorough clearance and approval. This was also the case for the Mayo Clinic. I'm very excited and proud to mention that we did pass vendor selection criteria. So that means that Triall is now an approved vendor for the Mayo Clinic. And with regards to other potential clients, we're in several other active conversations, but similarly, we'll only be able to announce that upon signature and approval. I think today's news we definitely celebrate, but everybody can count on the Triall team being very, very active behind the scenes. And I'm sure we will have some very new and exciting news in the not too distant future.
Thank you, Adil. So talking about clinical trials, I have another question. And this one has a bit more of a marketing angle, so I'll make sure to take this one. Has a clinical trial supported by the trial project or carried out by itself made any noise and attracted attention? For example, do you have a research or recommendation published in a TV channel or journal? I think this study in itself is attracting a lot of attention. It's a big milestone for Triall to be able to associate ourselves with a renowned research center. And as some of those watching right now probably know, we've also had some other big milestones in the past, starting with the first clinical trial on the blockchain in the summer of 2019. So that was essentially the first active implementation of blockchain in a real world clinical trial setting. Then in early 2020, we had our publication in Science, where we publicized how blockchain standards for decentralized identity and self-sovereign identity can be used in the context of data sharing. So that was also another big milestone for Triall in terms of generating awareness around our vision and building scientific excellence. And I guess the third one that I would mention is the COVID-19 clinical trial that is using trial software in its operations. Well, in parallel to that, we've also, of course, had a number of media mentions in podcasts such as Real Vision, Bitcoin.com, and Health Unchained. And these are of course things that we will continue to pursue. So for us, this is definitely not the end. It's only the beginning of a very exciting journey. Yeah, we are extremely excited to have the confirmation from organizations such as Mayo Clinic in building out this vision. And it brings me to my next question, which is more a technical related question. So I'm going to hand that one to you, Niels. How will implementing decentralized identifiers and verifiable credentials play a notable role to ensure that clinical trials are conducted in a safer, smarter, and more efficient way? Perhaps you'd like to start with just very briefly touch upon what decentralized identifiers and verifiable credentials are, and then after that, explain how that implement or how they impact enterprise operations, such as clinical trials.
Yeah, sure, happy to do so. So first of all, decentralized identifiers, they are basically similar to what you see in a normal database. So if you are encountering an organization, typically they have some information about you on file in the databases. And what happens then is that they need to uniquely identify that data, which then also means that whatever customer or client or a third party, they associate a unique identifier with that party basically in their database system. That's done automatically, so they don't have to think about it. Decentralized identifiers are a bit similar in a sense, except for the one really big difference is that this is an ID which is basically managed by that party themselves, so not by the organization that is saying something about you. And that decentralized identifier can be fully managed by you as a person, for instance, and can be on a blockchain. You can have multiple decentralized identifiers for multiple use cases for different interactions with third parties, and you are in control, and that's the really important bit of it. You are in control of creating that decentralized identifier and also updating or deactivating that decentralized identifier. And of course, underlying the technology is really technical. From a user perspective, it's not like you need to know an awful lot about those decentralized identifiers. That is all happening in a proper application through the UI UX implementation. So as a user, you typically don't really are aware of the fact that those decentralized identifiers are a really big thing. Those decentralized identifiers then basically hold certain information, and the most prominent information in a decentralized identifier is what are called public keys. And with those public keys, you basically can prove that any data which is being signed, for instance, or being encrypted, that belongs to you. So you can use those public keys, for instance, to sign a message so that a third party using your public key can verify that that message was authentic. And that signing happens through using a private key, which only you have access to, which is belonging to that public key. So they are a pair, basically a key pair, an asymmetrical key pair. Similarly, you can use that to encrypt data. So I could be using, for instance, Array's decentralized identifier, one of the public keys in there. And then if I don't want other people to be able to read data that I'm sending to Ray, I could use his public key to basically encrypt the data and then sign it using my private key so that Ray knows that it's me sending that data. And of course, since Ray has access to my public key and has access to his own private key, he's also able to he's only the only one able to decrypt that data. So far, the technical details about decentralized identifiers. Sorry if some people lost me. It's complex stuff, I guess. On top of those decentralized identifiers, you have also the concept of verifiable credentials. And a verifiable credential is basically an attestation or one or more attestations by a issuing authority. So that could be, for instance, the government, it could be your employer, it could be basically anyone that can make an attestation, for instance, about you. And those verifiable credentials are typically bound to those DIDs. They don't have to be, but they are typically bound to those DIDs, both on the issuer side, so the issuer has a DID, as well as on the subject side. So what is this verifiable credential attesting about which person or which object? Then that person or object can also have a decentralized identifier. Then comes the third sort of role within a verifiable credential and SSI ecosystem, which is the verifier. So we talked about the issuer, we talked about the holder, which is basically the subject of the data, and then you have a third party, which is the verifier that wants to know something about you. And the simple use case that I like to use and is a well-known example of this technology is when I want to buy some liquor in a liquor store, I need to prove that I'm an adult. In the Netherlands, you have to be over 18, for instance. In some jurisdictions, you have to be over 21. Right now, I'm luckily old enough that they can definitely notice that I'm not 18 anymore. But let's say we went back 25 years and I would be roughly 18. Then they would ask me for a passport or an ID card or anything. And at first glance, you might think, hey, that's okay, right? But if you then know that basically there's way more information on that ID card that they could be copying, like for instance, your first name, last name, exact date of birth, where you were born, from which country you are, and stuff like that, and even in the past, social security numbers, etc. I think we all know the hotels making copies of your passports or taking your credit cards and stuff like that. You don't want that. Only the liquor store only needs to know, hey, are you over 18? Yes or no. That's the only answer. Verifiable credentials allow for this type of questions and answers, basically. So let's say that the government would have handed out a verifiable credential with all kinds of information about me, and I would be entering that liquor store. I wouldn't have to provide my name and an exact date of birth. No, only the question, are you over 18? Yes or no. So this is a very important technology that we are using, basically also in our products. And in the short to medium term, this allows us, for instance, to sort of integrate all kinds of disparate systems, so separate systems, and also maybe even more older and more, well, legacy might be not the right word to describe them, but having all the systems basically being able to talk to other systems that are not integrated directly, for instance. So blockchain technology allows for having two separate systems being able to provide proofs, to verify those proofs, but also with this technology, for instance, to be able to authenticate against those systems and to authorize against those systems. So the technology that we are working on allows you, for instance, to have like a single sign-on type of solution where you as a clinician, for instance, could be using multiple systems. Those might be separate systems, but you still would be able to use basically our technology to log in, to be authorized, but also when data is being entered into those systems to ensure that that data is anchored, for instance, via hashes and via signatures, that data cannot be manipulated afterwards, or if you would be manipulating that data, that it becomes visible to everyone, basically. If we then look more into the future, what will happen is that more and more clinical trials, but basically also, if you take it a bit broader, more and more interactions will be peer-to-peer. meaning that it might not necessarily be that you have to have all these central systems available every time with networks connected to each other. No, it might be that you have this disparate system with maybe a clinician, for instance, and then a client, a patient sitting in front of the clinician without knowing, maybe without really verifying via passport or whatever, knowing that that is a real clinician, for instance, operating on behalf of a certain clinical trial party, or that is really a patient. And with this technology, it means that you can authenticate against each other and also ask certain questions without getting and giving away too much information, and basically being able to verify that, because that verifiable credential technology allows for that verifier to not trusting the person in front of you, to trust basically the issuing party, which of course means that there is a process in place before that. And I think I've talked more than enough about the subject. Sorry for that.
No problem. Thank you so much for the elaborate answer. I think you're touching upon a lot of important topics, starting with privacy, but also the possibility to have more ownership and control over your own identity data, over your own data, and the possibilities that that opens up in terms of promoting interoperability, in terms of connecting separate, isolated systems. Is highly relevant in our fields, considering that many stakeholders are still using many different systems side by side, and it's probably not going to be different for a while. So that means we should really think, and I guess that's what we do every day. We start to think about what can we offer in terms of value today, and what can we offer in terms of value in the future. And yeah, the whole peer-to-peer ecosystem, we're still in the early days, but it's good to keep these things in mind and to really build something that's gonna stand the test of time. So yeah, thank you so much for detailing that news. I have another question for you, and this relates to it also relates to the software, and I guess it's also an important topic, not maybe not fully directly related, but definitely indirectly related. Question is the trial platform open source? So maybe you can tell a bit more about how we view using open source components around our platform as it is right now, but also in the future, and how that sort of ties in with this decentralized peer-to-peer vision.
Yeah, sure. So first of all, the answer to the question is yes and no, which doesn't help a lot, I guess, so I will explain that a bit. Open source software we regard as very much needed, especially if you're talking about trust. This technology, self-sovereign identity technology and blockchain technology, that is also sort of handling your private data. So we can say, hey, you are in control about your own data, for instance. But if then you have this really closed source application, how do you know that that data is not being sent to a third party that you don't know anything about? So open source software is, basically sort of the basis of all the solutions we create. And that also means that, of course, we're not only using open source software of other parties, we're also creating open source software, which other parties can use. And you have to look at that basically all the smaller pieces, all the libraries and stuff that we are creating, those are typically open source, so that anyone is able to see if they want to what's happening, or to expand upon the open source software and components that we create. But then on the other hand, we also have, of course, the platform, which is sort of like an integration of all kinds of libraries that basically allow for a value add for the different parties that are seeking to use our products. But at the same time, you will see that, for instance, if in the future we will be providing you with a mobile app, that app itself is comprised of all kinds of open source components so that everyone can see, hey, nothing strange is happening. They are really doing what they say they are doing. So open source is really at the core of everything we do. And yeah, we will be providing an awful lot of libraries that allow you to interact with all those systems. But specifically, if you look at, for instance, connectors to a really specific clinical trial system, those are typically closed source, and as well as, of course, the clinical trial software itself, especially if that's integrated into a third-party solution. Those are typically closed source, of course.
Yeah, thank you for explaining that, Niels. Yeah, I'm going to jump to the next question. So we know there are lots of benefits for companies using trial software, but can you explain a bit more about how patients would benefit from implementing your software? Arno, would you like to take that one?
Yeah, thanks, Ray. That's, I think, another great question. And I think it's, I can answer that on multiple levels. I think in the short term, well, Niels already touched upon the identification part. So I think that patients are more comfortable with the fact that they can do things the clinician need from their homes, so they don't have to go into the hospital because they can identify themselves from a long distance, so not being in the hospital. And I think that in the end, and that's why we're all doing it, I guess, is that we are able, with the whole system and with the whole structure that we're building, is that medicines are coming sooner to the market than it's the case now. So I think that where you have the individual benefit, which is more, it's more use of it. Yeah, it's more comfortable to be part of a clinical study as a patient. You're more able to have some overview of what the clinical trial entitles and what it does and where it stands. And on the bigger picture, I think a lot of patients will benefit from it because clinical trials will become less lengthy, and therefore medicines will come to the market sooner. And I think there's another part, and I think that is that the technology Niels already touched upon could also help in the end to create value for patients to share their data within clinical trials or to pharmaceutical companies or whoever can use the data to create a better healthcare system. So I think it has multiple angles here.
Yeah, thank you so much for explaining that, Arno. I think it very much relates to increasing this patient convenience on one end, and also providing the patient with yeah, I guess what you could call true empowerment. So actually giving them ownership and control over their data, and actually eventually also providing them with the possibility to monetize part of the data. And that's a vision that won't be created in one day, but it's certainly something that we're looking to build towards. I have another question that is more about our uniqueness, and I'll be happy to take that one. And it goes as follows: do you fear that others can copy what you are doing, and in time all clinical trials will be conducted with blockchain technology, thus diluting your uniqueness? Well, blockchain is certainly one of our key differentiators, especially at this time, since we're one of the front runners in the field. But of course, our competitive advantage comes forth out of a combination of different differentiators. So to sort of walk you through them, on one end, we have this end-to-end software platform. And I think one of our strengths is that it's truly end-to-end, which means that you can essentially do all of your clinical trial activities under one roof. Well, highly beneficial if you consider all of the interoperability constraints, if you consider that most of the time people are creating manual exports and importing it again into a different system, quite often using a data capture system and a document management system, all side by side from different vendors. So being able to do all of that in a single platform provides a lot of efficiency and can really help stakeholders reduce timelines and costs. The second thing is that the platform is also really developed with mobile devices in mind. And this has really been done because we see that nowadays people are using their smartphone, using their tablets, they're on the move, they're working remotely. So it has become more and more important to be able to leverage software from any device and any location, especially if you consider the whole movement of decentralizing clinical research with patients conducting or participating in research from the comfort of their own home. So I think that's also another important factor if you consider the software, that it's really mobile native, really designed with the mobile devices in mind. A third point is that it is also affordable if you compare us to some of the other vendors in the space. So what you see is that if you look at other vendors that offer true end-to-end platforms, they're quite often very, very expensive. And for that reason, they almost exclusively only serve big pharma companies, which means that many small to medium-sized organizations do not have the luxury of leveraging an end-to-end platform. And that's something that we really would like to change. We'd like to change that because we simply think it's not fair. We also like to change it because we see that the majority of clinical research is being conducted by these small to medium-sized organizations. So with them not being efficient, with them making a lot of unnecessary costs, it actually has a macro impact on the entire industry, and it delays timelines in terms of introducing new medicines. So that's really something that's quite important for us. I think another differentiator in our case is really our thought leadership position. So we've been publishing about blockchain since 2017. We managed to implement first clinical trial on the blockchain, as I explained earlier during this AMA. And as Niels just explained, we're working on this highly innovative self-sovereign identity infrastructure. And at this time, there's no party that brings all of that together. And of course, we will continue to grow. We will continue to scale Triall and to develop our future product range and onboard more clinical trials, increase our network. So these are all factors that contributes to our uniqueness.
Yeah, and if I may, Ray, thanks so much. Great response. I just think that we as a company, we don't necessarily look at what differentiates us, but I think we're looking at what we have in common. So everybody is now understanding and realizing and really open for change with regards to how we manage and oversee clinical trials. So we at Triall, we're very much open to so-called fair, honest, and healthy competition, because there is a tremendous tremendous landscape that we feel needs to be changed. And we can't do that all by ourselves. We feel we have a leading role there, and I think today's announcement will help us to move forward in our journey. But we're always encouraging other groups to also innovate with us, co-innovate with us, or at least let us know that you're out there, and see how we can use each other's momentum as a force for good. So I think that's what we are looking into. And as part of the ecosystem that we're envisioning, we already know that the clinical trial space is an important element, a very important element in getting costs of medicine down, in supporting equality in terms of access to medicine, in terms of giving bright and young doctors a means to bring their idea from bench to bedside. But we also know, because we're dealing with emerging technologies, that there are so many other areas, where that need a lot of very enthusiastic and ambitious groups, like how we see ourselves. So at the end of the day, it is good, to be very recognized as a company. But I think when we look on the inside, we always try to find allies. And if it means healthy competition, then we're very much happy to see these activities and support other groups as well, all for the same common cause.
Yeah, thank you for that great addition, Hadil. I cannot agree more. I would like to have a look at some of the live questions that came in. I saw one comment about Niels Cat, who is missing today.
Yeah, sorry, I'm in the office, so no cats there. We did have dogs walking around, though. They're not there anymore.
Yeah, next time. I see one question that's also about Mayo Clinic, and Adil, maybe you would like to touch some light on this one. So it goes as follows: given the latest news regarding the trial Mayo Clinic collaboration, what are your thoughts on blockchain adoption levels and future adoption rates in the healthcare and medical research industries? Is the strategy in this sector different, or rather top-down adoption, large corporations first to small businesses second, or how does that work? Adil, would you be able to touch upon that a bit more?
Yeah, so I think what we've been seeing is that there is really no structural path towards adoption. And there is no linear line of where you start and then just follow that line and you'll end up where you want to be. Same as with all disruptive innovations, it goes from up, down, left, right. For instance, we see regulators like the FDA being very active and familiarizing themselves with blockchain applications in clinical trials. So one could say, right, that's really, the top level of decision makers where the rest of the industry has to comply with. We see also that, here in Europe, on this side of the pond, that digitalization of clinical trial processes is very much on the agenda of the European Commission, for instance. For instance, they gave a lot of grants, and they see they're asking not only for the bright scientific innovations, but they're also very keen in how are you going to make your data available, right, with other groups. How can you make sure that your data integrity is secured, right? How can you make sure that that your data is durable in other way, that it can be recovered, right, in years and years, and that it can be reused. All kinds of privacy specific topics are being mentioned there. All kinds of data dissemination tactics that you need to include as part of your scientific research proposal. So this is something that we've been seeing in the past few years, and I think that we will be seeing more and more of that. So to summarize, the science and the operations really starting to go more hand in hand. On the other hand, we also see, and we're also in conversations with several small companies, really startups, that see or that use blockchain as part of their product development strategy. Right, so this is really the other end of the spectrum, and I think this is very exciting because that means that across the board of all these stakeholders, all these groups, they recognize that blockchain as technology in combination with other digitalization processes and approaches, that this could be an important enabler, all again towards the same common goal, like I just mentioned. So for us, it's all very exciting to see this, and we think that the adoption rate will increase. And we think that the announcements of the Mayo Clinic and Triall will definitely help there. Yeah, we can't wait to see where we will be in 12 months from now.
Thank you, Adil. And I think that has brought us to the end of this AMA. So we hope that you've all enjoyed listening in, and we will have another AMA in probably less than 30 days, end of this month. And we'll be very happy to answer any new questions that might pop up in the meantime, or if we haven't touched upon your question, please feel free to ask it again. You can ask it through Telegram, you can ask it through the dedicated portal that we always put up. And of course, you can ask it during the live session, either on YouTube or in our Telegram community chat. Yeah, we very much enjoy doing these AMA sessions, and we'll be back for the next one.
Great. Thanks, Ray.
Yeah.
Thanks everyone for watching.
Thanks, everyone.
Bye-bye.
Bye.
Bye-bye.